He never thought he was going to walk again. And she was definitely going to lose that leg. But then we encouraged her. She had some sessions of hyperbaric oxygen therapy, and the foot came back to normal. The mind is actually very powerful. So recovery doesn't have a ceiling, and recovery doesn't have a particular timeline. Unlock more, we mean getting people to unlock the hidden potential. My name is Chinedu Awo. I'm a medical doctor by profession. I also have a master's in public health with the London School of Hygiene and Tropical Medicine. There was need for us to proactively do things to change the trajectory, to become more positive, give us better outcomes, rehab outcomes. So I've worked as a stroke consultant in many of the NHS hospitals, and during that period I was exposed to the chronic challenge the stroke teams face, and that is bed availability. So patients come in with acute stroke, they get treated, and because there is a pressure to create bed space, their rehabilitation is, in my opinion, rushed, and they don't get the maximum rehab they ought to get before discharge. And so as a result of that, patients get discharged prematurely without actually achieving their maximum potential. In my opinion, I think people think rehabilitation is just coming to do exercises, therapy, and all that. That's a lot more than that. Rehabilitation is holistic. So when we admit a client to our facility, we look at the whole picture. We look at his social background, we look at his family, we look at the hobbies, the things he likes to do, he enjoys doing. Person-centered care goes a long way. You see that they become more positive, they become more alive, they laugh more, and they smile more. They now have hope that there is more to live for, and that goes a long way. So it's not just the therapy aspect, there's also the psychotherapy aspect that's very important in rehabilitation. Unlock more, we mean getting people to unlock the hidden potential, because more often than not, people get the impression they've actually reached the maximum they can achieve in terms of mobility and going back to doing what they love doing. So people unlocking their potential. So the state of the mind goes a long way, and part of the things we do here to help people is to encourage them and to unlock that positive potential and make them believe that they can do more and they can achieve more. So recovery doesn't have a ceiling, and recovery doesn't have a particular timeline, shouldn't, because you can actually always achieve a goal further. So what we tend to do here is encourage people to go beyond what they feel they can achieve, obviously with guidance, with encouragement, and making sure it's done safely and realistically. And we've achieved quite a lot here, actually. We have some of our testimonials on our website, www.abundanthealthuk.com. We had a gentleman that came in with right-sided weakness following his stroke. He never thought he was going to walk again. But a combination of the hyperbaric oxygen therapy, the hydrotherapy, we have a passive limb motion machine that even if your limb is, if you're paralyzed, if you've got a palsy, the machine helps to move your limbs and exercise the muscles. And that's a combination of that with positive energy, encouragement, experienced therapist. He's gone back to the gym now. So there's nothing no amount of money can give that kind of satisfaction, job satisfaction. And we had a lady that came in with ischemic diabetic foot, and she was definitely going to lose that leg. But then we encouraged her. She had some sessions of hyperbaric oxygen therapy, and the foot came back to normal. Because I understand the importance of oxygen to cell health and cell rejuvenation and healing as well. Oxygen, again, has a very strong anti-inflammatory property. There's ongoing research about the role of hyperbaric oxygen therapy in rehabilitation, but I think we are getting really positive results with the HBOT. Well, any patient that will need oxygen, well, particularly stroke patients, what happens in stroke is there's disruption of oxygen supply to the brain. So the stroke can either be thrombotic, when there's blood clots blocking the arteries, and then there's no blood flowing through to deliver oxygen to the cells. Or like the lady I gave an instance about, one of the things, she came for her food, but then while she was having some sessions for her food, she then realized that she was sleeping better. Because she was sleeping better, her blood pressure was better controlled. Her blood sugar, amazingly, was better controlled as well. So, and we had another gentleman, he was playing football, and he injured his right knee. He had a chronic left knee problem. He had a few sessions of the hyperbaric oxygen therapy. Not only did this get healed in terms of he could play football again, the chronic left one got healed as well. So yes, like I said, there's still ongoing research. What we're seeing here is seeing positive results. There's no such thing as this is as good as it's going to get. It's all in the mind, because it's said that we are the outcome of our thoughts. So if you believe you can do it, let me give a practical example. You go to the gym and you go on the treadmill. Just after 1 minute, your body starts complaining. Your body wants to stop. But your mind can actually tell your body to keep going. So there's no such thing as, oh, you've reached the end of your rehab. Just keep positive, keep pushing yourself, obviously safely and with the guidance of professionals, rehab professionals. So the ceiling cannot even limit you to what you can achieve. Someone that's had a stroke will want to unlock independence. They will want to unlock their confidence, because their confidence drops because they are not sure if they stand up, if they're going to fall. So it's for us to help them unlock that confidence that they should be able to walk independently again, unlock that hidden potential within them, and also unlock that hope to live again. I'll ask them to look for the nearest rehabilitation facility to them and get assessed. It's very important. Assessment is very important, because rehabilitation shouldn't just be general. It should be person specific. So the starting step will be to look for a reliable rehabilitation facility near you and get assessed. When they live abundant health, I hope they've unlocked hidden potential. I hope they've unlocked the fact that life is what you make it. I hope they've unlocked the fact that it's not what happens to a man or a woman that determines the outcome of his or her life, but it's how they handle it. I hope they've unlocked that there is hope for a better tomorrow, and there is need to keep positive.